G'day, my name is Pat Ham. I'm an account manager in the healthcare vertical here at Cisco. We're here to talk today to Louis Hamon, Chief Medical Officer of Our Brothers of Broken Back and Bended Knee Health System, located in Northern California. Archduke Hamon, can you tell us a little bit about the goings-on with Our Brothers of Broken Back and Bended Knee Health System?
Pat, we are so excited to have you here today at Our Brothers of Broken Back and Bended Knee Health System. You asked, what is our number one priority? It's electronic medical records. In fact, we've spent $110 million on it. Can you believe that? That is just outrageous. I hope it works. Maybe you can help us. Maybe the Cisco Borderless Networks might help us ensure success. Is that what it can do? Tell us all about it.
Cranky! $110 million on a health system? Are you kidding me? It's a good thing that I showed up on time, eh? What I'm going to talk to you about is borderless networks. What we're really talking about is the ability to do business anywhere, anytime, securely. Archduke Hamon, Cisco Borderless Networks is really divided into 4 sections. First, we have borderless mobility, very important in the healthcare field. Second, we have energy-wise technology. Going green is the big thing to do today. Number 3 is TrustSec, security, with HIPAA, JACO, and all of the compliances coming up, very, very important to our health system. And the 4th is MediaNet, video. How do we get video around? Telemedicine, telestroke, telehealth. Video is becoming pervasive. And how do we address that? Those are the 4 topics we're going to dive into deeper right now. Archduke, right now we're going to talk about Cisco mobility. As you've probably seen in your own lobby, devices are popping up everywhere. Physicians, clinicians, administrative staff. Why? They're asking to work anywhere. Can you believe it? It wasn't more than 5 years ago. The only place we had to worry about our people working was in the hospital, right here, where we could keep an eye on them. Now we can't. They're logging in from Starbucks. Why? Blimey, we're seeing iPhones pop up everywhere. We're seeing iPads. I saw a physician sharing him health information right out in your lobby. I sure hope it was secured, because there's a lot of fines if not. We're going to talk about the ability to secure that communication. So regardless of where your employees want to work, we can allow them to work effectively, work securely, have access to their health information in a secure fashion. From Starbucks, believe it or not, that's part of our Cisco Mobility Solution Suite. On the iPhones, as one of the most adopted technologies by the physician groups, we have technologies such as Cisco Mobile 8. That allows me to take this device, this iPhone or this iPod, and turn it into an enterprise communication device, as well as securely connect for data calls over the wireless network. We have what's called clean air technologies. As you know, in healthcare, there is stuff bouncing all over the airs. We've got modalities that are pushing out radio frequencies. We've got X-ray machines that are bouncing all kinds of new things around, creating havoc in our environment. We need to be able to specifically identify what's going on so that we can remove and remediate any challenges. We do that with radio spectrum analytics that are built right into our access points. So no more guessing what's going on in the environment. At any point in time, through clean air and through Cognio, the technology we've integrated in that for spectrum analytics, we're able to figure out what's going on immediately and address it and remove those issues that are creating havoc with our healthcare devices. With all those old systems, all those workstation on wheels that are moving around the hospital as well, we have Client Link, those B and G antenna radios that are aging but still of useful life. Client Link allows us to communicate with that wireless infrastructure and maximize that connectivity. The bottom line with this technology is we can remove the challenges and we can address the devices and ensure maximum productivity out of our existing and future technologies. That, in a nutshell, is what Cisco Mobility is going to bring you. Isn't that fantastic? Archduke, one other point I wanted to make before we move on is security. We've seen a huge invasion come into the US. We call it the I invasion. That is devices such as these proliferating all across the enterprise. And the challenge is physicians and clinicians are starting to use these devices that they bought themselves to share private healthcare information. That's a violation of federal law. That comes with many, many consequences. What's Cisco done to address that, eh? Well, what we've done is we've developed what we call Cisco AnyConnect. The value that brings you is to allow those consumer devices to have a secure VPN client on top of them so that when they do connect from a Starbucks, from their home office, even from your public network, we can do it securely so that no information ever leaks out to the public. That covers your assets. We think that's pretty exciting. I hope you do too. Do. There's two things we want to finish up on, but in the sake of time, we're going to cover them at a high level. The first thing we want to talk about is energy-wise. As a healthcare system, having spent $110 million on an EMR system, we need to save some money. We also need to be green. What energy-wise allows you to do is, well, it's like the Prius. It's on when it's on, and it's off when it doesn't need to be on. It's as simple as that. It saves you watts of energy over time and allows you to operate electronically efficiently. Something we need to dig into deeper. The second thing we need to talk about and finish up on is around our media net. As we know, specialists, getting them out into the rural parts of America is very difficult, very challenging. So we need to be able to take video and be it deployed over wireless or over wired technologies and networks. We need to be able to do that very effectively and very efficiently. All of these systems form what Cisco calls our borderless networks, a world of healthcare providing without the boundaries of the brick and mortar of previous years. We're able to do business securely. We're able to remove obstacles such as radio frequency interference. We're able to operate securely with things and technologies such as AnyConnect. We can turn our consumer devices like our iPhones into enterprise communication devices. All of these driving value into the clinical care workflow, creating greater results and creating more operational efficiencies that we can change the face of healthcare today. We appreciate the time to share with you, and hopefully we can dig into these technologies a little deeper and see how they fit into your network today. Thank you for sharing time with us, and have a great day.